Soy Daniela Otero, la directora general de Skål Internacional.
I am Daniela Otero, Chief Executive Officer of Skål International, and I would like to thank you all for joining us. Today's topic is focused on recovery, hence the title, Planning for a Safe Restart of the Tourism Industry. With the extensive program of vaccination on a worldwide level, the tourism industry is preparing its gradual reopening. But is your company or your business ready for a safe return to work? The idea today is to get to know several effective actions that we can take to achieve a safe return. This is what is useful and what is not useful, and also the consequences of not knowing the difference between both. In order to do so, I am going to introduce you today to two people, Mr. Ramón Sánchez Piña, who's doctor in environmental health of the Public Health School of Harvard and lead investigator in projects related to sustainability and technologies for the prevention of diseases. Ramón, please, if you could open your microphone, and we welcome you. Also with us is Dr. Maria Luisa Gómez.
Thank you, everyone.
Doctor-in-law and professor of administrative law at University of Malaga, here in the south of Spain. Thank you very much for joining us today.
It's a pleasure to be with you today, this morning, or this afternoon, depending on where you are.
Both have extensive experience and are prestigious scholars. Thank you both for your generosity to share your knowledge, and thanks to the University of Harvard and the University of Malaga for letting you have this meeting with us today. So first of all, Ramón, I would like to start with you, if you agree with this. I know that from May last year, you have been teaching weekly courses on technologies and practices to prevent COVID-19, as well as strategies of containment of the pandemic. This has been a really busy year, and the lack of scientific information about prevention of COVID-19 generates many myths that lead to useless actions, which often are costly, and you assert in previous conversations that we had that this could be easily redressed. We have scientific information on what is useful to prevent COVID-19, but it is not distributed or spread adequately. So what is going on, Ramón? What happens?
First of all, thank you for your invitation. And I have to say that, first of all, we have to talk about the lack of confidence between the authorities and the other sectors. There's loads of information, and people think that all the information has got the same value. If people say that with a drop of lemon and some tea, you can cure COVID, that is not obviously the case. So the problem that we have is the lack of confidence. We don't have good connections between the academic sector and the productive sector and the government, and that's the main thing. And second is that there is loads of interest on this subject. We have reports on security when traveling, reports on safety in terms of having a certain level of occupation in restaurants and how things can be improved. But the moments that we want to issue this information to society, the society will let us know, but I found this in Facebook and this is what they're saying. But where are the sources? Where are you getting this information from? What is the situation? And the government has got a very high level of responsibilities to figure out all the sources and check the sources. So for the government personnel is is to do what the safest thing for them is. So if we have tour operators with buses, I just forbid them, because then I know that there's no infection there. And other people say, okay, I'm going to give everyone testing, that everyone who's getting on the bus, and in that way I can be sure that nothing will happen. But in reality, what they can do, which is just as effective, but they don't do it, is to say, okay, I'm going to buy a high filter that is $20, and with that, I'm going to have a high level of protection. So the problem is that this lack of connection between the industry and the academic sector and the governments, because obviously people are not following science, and that all the sources of information seems to be valid, and people are not reading what we're writing in scientific documents.
Yeah, that's right. And this is something that we have seen on many governments. It's the lack of respect that they have towards the suggestions made by technicians and by scientists. So the idea today would be to have a more scientific focus, because the restart of the activity is a fact. So we believe that by democratizing the access to effective information between the decision makers, we can prepare ourselves to start with the return to our activities in gradual and safe manner. As I believe, Ramon, there is a need to learn model to evaluate the risks of the different activities, with which the specific groups can evaluate the risks of different activities, and so the specific groups can prepare plans for a safe return to the activities of each of the sectors, hotels, restaurants, events, and so on. So the idea is to create a perfect scenario to offer the customer the trust that they need. I believe that you have some really interesting information to share with us, isn't it? Data that you have prepared together with Maria Luisa, which I believe is information quite clear and interesting, and I would like you to share this with all of us.
If it's possible, I would like to see whether you can actually upload it, because I'm having problems here to
Yeah,
upload
perfect.
it.
Because in this introduction, it is prepared in Spanish, because it's the language that we are having today, even though we have translators. But most of the material from University of Harvard is also available in the English language, isn't it?
Yes, that's right. And a very important factor is that we got to do away with the myths, and people realize what the reality is, so we can easily prevent COVID-19. So I'm just going to start with something very simple. There are three ways of transmitting COVID-19. Next slide. Next slide again. Next. So there are three ways of transmitting COVID-19. The first one that everyone was talking about, contaminated surfaces, and this is only 10% of all the infections. And people were putting 90% of the resources to sort it out. And why? Because this is what you can see. It's not like it's not useful, but it's got very little impact. The second one is by the droplets that are inhaled when they are sneezing, coughing, etc. It's very little, but again, it's still 30%. And 60% is by aerosols that stay in the air and they're not seen. So you can maybe enter a room and you think that there's nobody there and it's clean, but there are actually aerosols in there. So next slide, please. So we realize that people invest loads of time and money to clean surfaces, and it's only 10% of the infections. Next slide, please. And something else we have realized is that with the highest level of technology, they can disinfect better. And here we got an example on a plane where people are using ultraviolet lights to disinfect an aircraft. Next slide. But really, the manual disinfection is more than enough to reduce the spread of COVID-19. So on the previous one, here, for instance, the robot will take 2 hours in disinfecting the surface of the airplane. If we put 3 or 4 people to do the same job by using manual cleaner, and they do it fast and just clean where human hands are touching it, then we will only take 1 hour instead of 2, and the cost is going to be less than half. And also the quality of hand cleaning is even better, because with the robots, sorry, it's on silence. Okay, we have to wait for the ultraviolet light to reach every space. So technology will not reach the best type of disinfection. There's also other disinfectants that are being used, which would be the equivalent of disinfecting by hand, but it's more expensive. So it's not very relevant because it's only 10% of the infections. Next slide. So manual disinfection is more than enough. Next slide, please. And also many salespeople in the tourist industry will tell us to put plastic barriers like plexiglass. So they just sell and put up plastic barriers everywhere so people don't get infected. However, the effectiveness of this, please, next slide, we realized that transparent plastic barriers only have a 15% effectiveness in stopping COVID-19. And this is because they only stop the big droplets that some people exhale. But if everyone wears face mask, then it's exactly the same. And the only things that barriers do is stop ventilation. So as you can see here, is if we have plastic barriers in a place where in an airport with a low ceiling, we realize that the infection level that you see in red, if we put plastic barriers to divide the queues, then this plastic barrier will keep the virus in that line, so in front and the back of the person that is infected. So if we take off these plastic barriers, then the virus is diluted because of natural ventilation. So plastic barriers just shouldn't happen, but we were told to buy them in hotels, in airports. Tourist operators should buy them, and they're not useful at all. Next slide, please. Another myth is that PCR tests are the best way to detect who can transmit SARS-CoV-2. In reality, PCR tests have very serious limitations because they can only detect the genetic material of the virus, but not whether it's contagious at that particular time. And for this reason, we can say that a person has already had COVID-19. They're already recovering, they're no longer contagious, but the genetic materials is still detected by the PCR. And for this reason, they cannot go back to work for another 3 weeks. So really, the PCR testing are not all that useful. In many countries, people are asking for a PCR test 72 hours before boarding a plane to detect whether people have the virus or not, and this is useless. And next slide. It happens that the transmission period of COVID-19 goes from 60 hours after contacting the virus, after the symptoms disappear. So if I have a PCR test now, and an hour later I'm in the bar, exposed without any face mask, and suddenly I get infected. So it's going to be 60 hours before I can infect somebody else. But if I just done my testing and in 71 hours before or 61 hours before getting on the plane, I get infected, I'm still contagious on the moment that I'm starting my plane and when I'm on the plane, etc. On the other hand, if PCR tests are done 48 hours before boarding the plane, then that's when they work. Because if I do a testing and then I get infected just after the test, so I will still have 13 hours on the plane traveling without infecting anyone, and I can get to my destination without any problem. However, the PCR tests are very subjective and they give false confidence. So we got to be very careful with this. We have to do what science says. Instead of 72 hours, it should be 48 hours for what we've just mentioned.
Los países que están permitiendo viajes se pide justamente 3 días.
Something which is important to clarify, because countries are asking tests 72 hours before.
And this is exactly not any good. 48 hours is fine, but not 72 hours. So what can I recommend? A PCR test is about $20, 18 euros PCR test. However, if they did an antigen test, which is $5, this antigen test will tell you if you have or you don't have the virus and whether it's active, so that it can infect somebody. And this is with an immediate result, which will last 5 minutes. So I don't know why there is no grand scale testing when people are boarding a plane or maybe on a cruise ship. And this can be done very easily. Even if people go to a tourist place and when they leave, they can just pay this $5 and you can see whether they are infected or not. Or in some places in the world, they get a test when they get to the hotel, another test while they stay in the hotel, and another test just before they leave, when they're taking their plane back home.
Exactly, these I have heard of big chains that they even include this for free within their services.
That's correct. So next slide, please. So this is something, again, very important, a myth that is another technology that salespeople sell us are scientifically proven. And this is not the case. There are technologies that do work, like, for instance, sanitizing mats. But if we actually put a mat with a normal mat with a disinfectant and another mat where people can just wipe their feet, it works exactly the same. They got the same effectiveness. Excuse me a moment. So the same effectiveness, but the difference is that you have already saved 80% of the cost. So really, this is something that we need to know. And it's something that actually works. We can say works, but then let's see what doesn't work.
So these are myths that we have discovered through the studies at the University of Harvard. And now we will see what is not effective.
So things that are not effective. First of all, the ozone generators. The first problem is that irritates our nose lining, and this will make it more susceptible to the virus. So please don't buy ozone generators. What you can do is actually increase the problem. And very important, sanitizing tunnels. I just go crazy when I see a sanitizing tunnel in a beach, on a beach, and the people go through and they get almost fumigated in on the whole body, and this is really not effective.
Yeah, I have seen this in videos from South America where they did this with bikes and something else.
And it's completely useless and it's expensive. And I've seen an hotel chain that offered it, and it was such an expensive machine, and it's completely useless. And including what it can do is that people are sprayed with an enormous amount of disinfectants, which can actually cause another health problem.
There's someone over here mentioning that in Vietnam they are doing the same.
That's right, but that is because people are just too cautious. So, but I wanted to tell you what it works and what doesn't work. So next slide, please. So another thing that is not effective is outdoor fumigation. What's the point of fumigating a bicycle when you are outdoor? And we are fumigating a bike or the sidewalk on the streets. And once I even asked these South Korean authorities why they're doing it, if they knew perfectly well that it doesn't work, and they did this. Is the minds, is because people then will think that we're doing something. And this is why there is this term of a theater of disinfection, because that means that I'm doing something that I know doesn't work, just to show people that I'm doing something, because that's what they can see. And that is the theater of disinfection. It's a play. So disinfecting outdoor or fumigating outdoor is not useful at all. It can be useful for mosquito, dengue, or other diseases, but not for COVID-19. So next slide, please.
So let's focus on what is useful. Let's see, let's focus ourselves on real prevention based on scientific studies.
So next slide. So first of all, when you see somebody with a mask under their nose, there is a 0% effectiveness in not exhaling the virus through the nose. So masks are the best method to avoid inhalation of contaminated aerosols, but it's completely useless if you got it under your nose. And why should I mention this? Because in many places actually require a mask indoors, or in some places outdoors when there are loads of people. But the following happens, that people leave it under their nose, and not many people have a good methodology to put it on top of their nose, so it's actually effective. And this photo was sent to me by from Florida, and as you can see, there are loads of people, and some people actually are wearing their mask underneath their nose.
More than 80% below the nose.
So see what the tourist operator is doing. Once they saw people with a mask underneath their nose, they put them on the screen just to show that they were not wearing their mask properly. And if they didn't do it properly, then they just couldn't get into the place. But really, why should we be police? Because masks are the best method to prevent the expansion of COVID. They got a minimum effectiveness of 58%, up to 90% when you got a double layer cotton mask. It doesn't even have to be a surgical quality for it to work. And this is something that not many people do. There aren't any good methods to tell people that to wear their mask properly. So next slide, please. So here are 4 cases of how the mask works. So if we have a person exhaling and we can see the healthy person, what kind of protection level do they have? If they don't have, if they're not wearing a mask and they're close together, they got 0% protection. If the non-infective person is wearing a mask, but with a normal fabric and not surgical mask, it would be between 58 and 74% protection, depending on a type of fabric. If the people exhaling is wearing a mask, then it would be between 56 and 78%. But if both people are wearing a mask, they got between 81 and 94% protection. And this is just as much as being vaccinated. So that's why wearing a mask properly is so important at all time, and especially in places where there haven't been enough vaccinations among the population.
This is important, what you just said, because in Europe, America, Canada, several countries in Asia, the level of vaccination within the next days will be really high, but this is not the case in other countries. So insisting in having 81 to 94% of protection with the adequate use of face masks is really important, because these countries, once they restart with the activities, they will have some guarantees only if they continue with the strict use of face masks.
That's right. And in fact, we are giving some African countries a weekly course about COVID. And many of them cannot have the luxury of getting ill, because if they don't work, they don't eat. And they actually follow our instructions. So we can see how many African countries are now having a very low infectious level. So the issue is mask, ventilation, and social distance. And this is what they're doing. It's nothing to do with high technology, but they're actually following it. And in this way, they lower the level of infection. So an example, in a bus in Africa, that is this. First of all, everyone with a mask, otherwise they can't get on. 2, there was a person checking that everyone was wearing the mask on top of their nose. And if they do, then the bus driver will stop the bus and the person will stop doing that. And 3rd, they open all the windows of the bus for a good ventilation. And after that, they didn't have not even one case of infection in a million travelers. And this is not high technology, it's just discipline.
Muy interesante, y creo que puede ser una solución en el cortísimo plazo hasta que logren los niveles de vacunación.
This is very interesting, and I believe that this could be a solution on the short term in those countries where access to vaccination is not being desirable. So we'll continue.
So next slide, please. So surgical masks have between a 94-97% protection. And why is that? Because they're not particle filters. They're also electrostatic way to stop the particles. So the particles will stay there and they can not go any further. But this is something else that we can do. When you cannot ventilate the room or cannot clean the air with another type of technology, you can make the level of the mask higher, so the protection level is higher. In many places, to restart theaters and places where you can stay with other people and you don't have a high level of ventilation like on a plane, when people get to this place, they get given a face mask and they're told to be wearing it all the time. And this is why they got between 94 and 97 protection levels. So next slide, please. So vaccinations. So one of the important thing is that all vaccinations work to avoid severe cases and to avoid going to the hospital. All these vaccinations have 100% or a very good level for preventing people to be hospitalized. Another thing is not getting infected, because some vaccinations have a 94% efficacy and others have a lower one, but they all work against very severe cases. So any vaccinations that is offered anywhere is good, as long as it's approved by the World Health Organization. Please do get vaccinated. Here in the United States, 50% of adults have been vaccinated already, and about 15% have the first doses of the vaccination. In some places in the United States, people already feel that we've gone back to normality and they're not wearing masks outdoor. And what they do is just wear it indoors, and this is working quite well. But this is because of the vaccinations. Next slide, please. So the next one is that indoor vaccination is very important to reduce exposition to virus. So even if you're exposed to the virus, but there isn't enough viral concentration, then you don't have many chances of getting infected. So it's very important to have good ventilation on top of social distance, because if you ventilate, you're diluting the virus and it's going out, and there are enough chances of getting infected.
So, for example, in this case, when it comes to events, to our offices, our houses, the venting would be a sine qua non condition. In some places right now, winter is arriving and people say, how can I make this ventilation with the cold temperatures? For how long should I make the ventilation in order to prevent people from getting sick?
If you can open doors and windows to ventilate or do it through air conditioning, what you can use is high performance filters. Some of them have a 99% effectiveness to eliminate the infected particles. They are about $200 for a room of 6 by 6 meters. With a normal height ceiling, it would be about $200 to have this type of filter indoor that will clean the air, and this can be used in winter. So for a small restaurants, they can use one or two of these filters. It would be a good investment because it will reduce the viral loads by quite a lot. So if you can't open the doors and windows or use air conditioning, we can have these high performance filters. So please go to the next slide. As you can see outdoor, there are two people close together, and one contaminated and the other isn't, and the other one is further away. But as you can see, particles are moving because they are aerosols. So even if they are not close together, they could get infected. So if the infected person leaves the room, the aerosols can actually stay there and other people can get infected if the area is not ventilated. So how effective is this? So just by opening windows, you have about 65% effectiveness, and which is quite a bit because it lowers the viral loads enough. If you only open the doors, you got 33% effectiveness. If you open both doors and windows, you got 73% effectiveness. And if you use mechanical ventilation, so the air conditioning is bringing in air from the outside, and it's something very important not to recirculate the air. The air needs to come from the outside. And this is where you can have 80% effectiveness in reducing the viral load. So this is very important.
Several weeks ago, I was in Madrid because Fitur was first done in person, and the hotels, for those coming there, what they did is they left all of the hotel rooms with the windows open, and when the client came, he could close the windows, but all the windows were open so that they were naturally ventilated.
This is a very cheap way to do it. Or at least, if we turn on the aircon and wait for the right temperature, but it is effective enough to reduce the viral load. So next slide. So if you do physical activities outdoor, reduces the viral loads by 90 to 95% depending on the speed of the winds. People are asking me how to do the end of year academic party, the proms, and this is where they can have music and dancing and drinking. And yeah, we can do it if everyone is wearing masks when they're not eating or drinking. And especially if it's outdoor, and really there's been no cases at all when there's been a prom outdoor. So really all activities outdoor to have no problems. So next slide. And this is what I was telling you about portable filters. And this is a case of a restaurant in an airport where you can't open the windows because the airplanes are just outside, and obviously there's loads of noise and other type of pollution. So what they did was installing a high performance filter which has got an effectiveness of between 95 and 99%. So this restaurant spent $220 to buy this machine, and then can operate the all year or long. And the government had told them that they couldn't do it, so they just invested $200, and then they were allowed to operate. It's really that simple sometimes.
I'm thinking on the countries where winter is coming. This would be a really an expensive way of restarting the activities.
Yes, it's cheap enough. And in some countries, they can even use second-hand filters with new filters, or second-hand machine with new filters.
We have several questions from the chat. They are very interesting. I will ask you some of them. One of the question is whether if the face mask is so essential, why aren't there different sizes? There's only one size fits all. And for a lot of people, this is very uncomfortable. Do you know which is the reason for this? Why you can't find small, medium, and large face masks or face masks especially for kids?
The truth is that there are adjustable masks. I have one, for instance, and you can have it, children can have it, and my face is very big and you can really adjust it. The problem is that when you don't know how something important is, then you don't have the adequate measure for this to work. If you read on internet that masks do not work, and it's something that the government is imposing, then you don't have the respect for this type of situation. But there are adjustable masks. What mask manufacturers could do is create masks for children, adults, and teenagers. They really could have done it, but we didn't know the importance of the mask, because during several months we were told that they were not important.
Next question is regarding vaccination. You said that vaccination is the main factor of change, but only those that have been acknowledged by a specific area. As you know, the European Union has not acknowledged, has not approved different vaccines, especially those from outside the European Union. So the question is, how can specifically the European Union has a list of vaccines which are not acknowledged, which are not recognized. So how can the local authorities know about this?
The problem is local authorities. For instance, why isn't Sputnik 5 not recognized when we saw that it's actually effective, when it's been used on millions of people and we see that it's effective? So as long as the WHO say that, until they say that it's effective, then we don't use it. Maybe they can say that it's a safety reason, but if other people already are having this vaccination, then really they should accept it. And this is, the answer is up to the WHO, not the local authorities.
Another question regards these high efficiency particle filters. Do they only vent the air?
Yes, they only ventilate the air, but that's enough because that's where 90% of the infections actually come from.
We are a little late, so we will try to speed up and go through the most important points that you see, and we will have some more time for other topics.
The only thing that I'm going to mention is the layer system. There isn't only just one measure that is 100% effective, but if you apply, for instance, ventilation and mask and social distance, between these three layers, you can have 100% protection. But it really does depend on each situation. So the layers effect, so knowing everything that will prevent COVID-19 is what helps diminish this situation in its totality. But most people want a silver bullet that will sort everything out, and this is not going to happen. That's the only thing that I can say. But to do this, we need citizens to know all the safety measure and their effectiveness to prevent COVID-19, and then to start using this layer system in the best possible way, the most effective way for them. So authorities can say that you cannot travel by bus because you don't want infections there because people are so close together. Or they can say that buses can only travel on 25% capacity. There's no scientific foundation to say this. It's only what the authorities think. But on the other hand, they can say they can go 100% capacity, but everyone has got to wear a mask. Then it can be done.
We have also Maria Luisa here who would like to add some information regarding vaccines and face masks. So, Maria Luisa, you have the floor.
Creo que es muy importante lo que Ramón estaba comentando, y yo he remarcar un poquito más en esa idea. Creo que son medidas.
I think what Ramón was saying was is very important. I just wanted to say that it's a very low cost measure using a mask. And thinking about the questions that have been asked, I think the market is adjusting. There is a person in the chat saying that was saying that you can now buy different sizes of masks. So the market is adjusting. And this is what Ramón was saying, the needs when you actually have it. And we realize that this method, this mechanism is actually going to work to prevent contagion and is going to help prevent the situation so we can open up again with safety, and therefore the market has got to adapt as it is adapting in some parts of the world. But yeah, as I said, the market in general is got to adapt. And also I've seen that people are wearing the mask, but for kids it's very difficult to adjust it. So people need to take advantage of the resources they have to have the best methods to sort the problem out. And also what Ramón said about the different layers. And one of the layer is the layer of the legislation of what each government does in every country. They are telling us what to do and what not to do in all different countries. And the European Union is becoming very important in this process. In the whole world, people are seeing the problems under different views. And in Europe, we got a plan to implement this digital certificates, this digital COVID certificates. So vaccines are recognized as a good method to avoid infection and to avoid contagion, like Ramón actually mentioned, and to prevent this disease to create even more severe problems and even hospitalization. But we are seeing that many people in many countries do not quite agree with it. So this European certificate will also say whether you actually got the disease and got better, and if you have done any testing. So there is a layer of legislation that is very important, and is going to depend on each country how they're getting organized, and they are organizing the management of the pandemic. And this is on top of the WHO. There are European agencies that are actually taking care of safeguarding some coherence in the application of vaccination.
So, Maria Luisa, one of the questions is, what's your opinion on the green passport, which is being tested here in the European Union? And they have two questions from the legal point of view, and I would also like to have an answer from the scientific point of view.
From a legal point of view, as Ramon's mentioned before about the theater, I understand that what we try to achieve is safety, that people would feel safe, especially in the tourism industry. So we have to try as much as possible to create this safety, because otherwise tourism will not restart. We need people to feel confident. And if for this we need fluid information and know when people have been vaccinated, and we can open up again the restarting of this sector in a safe way.
And from the scientific point of view?
From a scientific point of view, we need a specific standard to see for this digital green pass. So if we got a passenger from New Zealand where there's no infection, even if they come without a vaccination, then functionally, if somebody comes from a certain place in the world with a vaccination that comes from the WHO recognized vaccination, a Chinese or Russian vaccination, I can say that this person is for sure is not going to be contagious. So there's this duality of having different government legislation for different regions, and this is what is killing the tourism sector, because the tourism sector cannot see whether I'm going from the United States to Spain and I'm vaccinated, I've been vaccinated with Moderna, and if Moderna is not recognized in Europe, then technically I'm not being vaccinated, even though technically and scientifically I have a minimum 90% possibility of not infecting it, and I've only got a 2% possibility of being contagious. So obviously there is this duality that is creating a problem.
I totally agree. And one of the questions I had, I believe that this pandemic will lead a lot of us to think about in all of the different aspects. On a scientific point of view, do you believe that we were not ready for a situation like this? We can see a lot of interferences, lack of organization, uh, information is not flowing. Did we learn? Were we ready? You live in the United States, Ramon, which is one of the countries with the biggest problems at the beginning of the outbreak. I believe that this is something that has been discussed over there.
Scientifically, we were prepared, but not socially. 20 years ago, I would have said we would have had more possibility of ending the pandemic than what we have now, because if a social network were not saying masks are not working, ventilation is not working, and do not get vaccinated because there is a microchip to follow you around. This didn't exist 20 years ago. If 20 years ago somebody said, scientific would say ventilation and masks are important, but because we don't know the virus, but this is maybe the way to sort it out, then the virus would have stopped. However, we are socially polarized, and in many places, people, for political reasons that had nothing to do with science, they would say that masks were not working, and many other things that were not scientific, that had no scientific ground. So obviously we have to learn many lessons to get ready for the next one. So something important is not to tolerate those people that says this doesn't work. Do not tolerate them on an international level. The same way where we do not tolerate human rights issues and leave them as international pariahs so that the situation can improve quickly.
One question: in a hotel in Houston, Texas, specifically a Westinghouse, they used 2 robots for the disinfection of the hotel rooms. Do you believe that this is acceptable?
It's acceptable, but it's not any better than two physical human beings cleaning it by hand. It's effective, but human beings, people can actually clean better because they can clean everywhere, because they can reach everywhere. So human beings are better than robots. So you're gonna spend loads of money and you don't have a better result. That's my opinion.
There's currently bubbles in different countries or areas, but we expect in the coming years that there is a reopening, either totally or gradually. What do you think about this matter of bubbles and travels between area with similar risks regarding COVID?
Scientifically worse. So for instance, people from New Zealand travel to Ireland, there's no problem, but there are loads of inequalities because, for instance, in sub-Saharan Africa, there's no vaccination, so they can't get into many tourist places. So it's a social inequality. So it would only work with areas with a low level of infection. So unless everyone has got access to vaccination, then we are creating social inequality. And if I'm allowed, I would like to say a little bit more on this issue, on this topic about solidarity, all the patents that should be available for everyone. Because in some parts of the world, vaccinations have reached a higher level. We cannot forget another part of the world where there isn't this kind of development. So we got a false sensation, a false feeling of safety because we think that we are controlling the pandemic, and that's not the case. This pandemic cannot be controlled until this happens on a worldwide level. And to act globally, we cannot think locally. We got to think globally. So we acting on a local level, but we have to think on a global level. We cannot generate a quality tourism flow. We cannot open safety corridors if we haven't sorted out all the problems that go beyond what people think that they can control.
Well, we are nearly finishing. I would like to say that restarting the activity does not necessarily imply back to normal, as the unpredictable period ahead of us will bring important changes in economy, in cultural standards, and in the values and behaviors that rule us as a society. To face the reopening and overcome the uncertainty that we spoke about, we need a plan to reactivate. For so some are recommending to be prepared for the different scenarios. I ask you both, can you give us some tips on how we can be prepared? And this is a question that I have heard on different meetings. It's from the point of view of the scientific world. Do you believe that these situations will happen again in the future? For example, we have heard that AIDS also came from a mutation from animals. This virus may also come from animals. So can we face this situation in the future? Should we be ready for something similar in the future?
Absolutely. This is just one virus of the thousands of viruses that are out there. In 2015, I did a presentation in front of the World Tourism Organization, and I talk about the pandemic and what happened. Some people actually listened and some other didn't. But what can be absolutely sure is that another one will come. So we have to be as prepared as possible. And this is the lesson to be learned from this moment. So social networks are not the justification for all the opinions are equal. You have to sort out what is good and what's not. Politicians shouldn't also give information about health or scientific information, because if I'm right-handed and I give information, the left and politicians are not going to listen, and vice versa. But a scientist that is giving information, everyone should actually listen to that person. What we can say is that the risk calculation, maybe I can record something on this topic, on the risk calculation, so you can calculate your own risk.
We will briefly explain what this risk calculator is. University of Harvard and Dr. Ramon have prepared some table where you can add some recommendations in order to know which is the percentage of protection that you have in your company. So if you agree, we will send this presentation together with the recording of the webinar, together with this calculator to everybody, together with other questions that we have been unable to answer today because of lack of time. The idea for us today is to bring some light in order to tell you reopening is possible. We only need to follow some steps which are easy to be taken, but we must be strict. And this is basically the idea. So one last thought before closing.
Dicen en inglés, si permiten que...
English, in English, if there is a way, there is a will, there is a way. So if we really want to do it, if we realize what is happening, if we listen to the people who know and maybe shed light on this, then we will find our way. And mine is that you know as better than anyone your business and how to handle it. And it's not as if somebody is coming from the outside and telling you what to do. But if you know science, you can figure out the correct layer to prevent COVID-19, and you can recommend it as a group that you are. You can recommend it to the governments, and the governments can create regulation to control this. We cannot be fearful of this or go for extreme protections. And you can really help on this. And this is why I want to share the method on how to evaluate your risk by layer, so you can recommend it to other people.
I would like to thank you again, both of you, for the opportunity to share with us all of this information. And I would like to finish with one sentence that I believe that fits to these moments. It says, adversity has the effect of eliciting talents which in prosperous circumstances would have lain dormant. I believe that it applies to this situation. Thank you all here today, and thank both of you for sharing this information. This webinar, as you know, is going to be recorded and will be distributed, and we will do our best in order to offer some light so that all of the stakers, or everybody involved in the tourism sector, can reactivate. Thank you. Thank you. Please wear the masks.
So take care of yourself, wear a mask, please contact us because scientists are here to help you out. And we've got some published work as well. I'm gonna give you some information.
Thank you. Any interesting material that you have, we will share it with all of the members of Skål. So thank you all. Thank you and see you.
Thank you.